and welcome to Talking AI, a podcast all about artificial intelligence, brought to you by Scan AI. My name's Nikki Dean. I'm a technology presenter with a particular interest in artificial intelligence, and my fantastic co-host for the series is Dan Parkinson, chuckling in the corner. He's Director of Collaboration at Scan AI, and he's here to bring his real-world experience and expertise. That's what I've been told.
Yep.
And this time around, we take a look at a different topic every week, don't we? We've covered some really fascinating ones, and this time is one I'm really interested in, and I'm going to really pick your brains on this one. We're looking at AI in healthcare.
No pressure.
No pressure at all. So when we talk about AI in healthcare, let's start with a very broad question. What does that mean?
So actually with healthcare, they've been one of the very early adopters of AI. So there's quite a lot of actual use cases and real world applications of AI within a healthcare setting at the minute. So they're using it in many different ways, from medical imaging through to patient care, robotics, and even in the sort of the pharmaceutical sort of side with the genomics, where they're studying DNA, or whether that's looking at drugs as well. So quite a broad spectrum of applications.
It is covering a lot, isn't it? So let's start with one of the terms that you used there, medical imaging. What does that mean, and how is AI used at the moment within medical imaging, and why is it a good thing? Why should we all be sort of aware of this, and what kind of benefits is it bringing to that industry?
So again, we keep looping back to this. I think one of the fundamental benefits is that automation and that improvement of accuracy, that speed to results is a very good metric of success. What is it? Is effectively looking at, it could be x-rays. Traditionally I've broke a lot of bones over my time.
Your own?
Yeah. Oh, definitely. But when you go to hospital, you go to the room, have an x-ray done, and then that person sends it off to a doctor, and you may be waiting around for a couple of hours before you get that review, and they say, yeah, you have actually fractured such a bone, and then you need to come back to the fracture clinic. That's the traditional process. What's happening now is, with AI, that's being used not just sort of for broken bone x-rays, but for sort of all sorts of illnesses and ailments, whether that's cancer detection, whether that's, whatever analysis you want to sort of perform on some form of x-ray, on a CT scan. And it's automating a lot of that process. So traditionally you would have a physician who's experienced and knows exactly what they're looking for on that particular x-ray or whatever that looks like. And rather than sort of waiting around for them, they can maybe take 15, 20 seconds to analyze an x-ray to find out the exact, the specific part that is maybe not necessarily the best news for someone, or it's something that is abnormal. That can be automated, and you can get a robot to do that with maybe better accuracy or increased efficiency. Again, we keep talking about that.
Yes.
So you can scan a lot more and a lot faster and get faster results for patients.
Well, that's what I was going to say, because you mentioned about accuracy, and obviously, when people are looking at these sort of images, they're very highly skilled, they probably have years and years of experience, but still that margin of error for a human, all the things that we've mentioned in the past, if you're a bit tired that day, or eyesight's deteriorating, or you've just had a really, really busy day, there's always that slight danger, not to worry anybody, but that you might miss something, or that for the patient, you've got to wait around all day because there's a big long queue. So it improves accuracy, saying, and also that sort of time to diagnosis almost, doesn't it? Yeah. That said, because we have talked, obviously, in the past, is AI taking our jobs? I think it's fair to say that will never take away the role of a human being. So it's almost like a very reliable second opinion, if you like, or first opinion, and then it's obviously analysed by a human being who will say, yes, that looks to be true, or actually I've found something else again, or whatever, let's relook at it. Yeah. So it's never going to replace, because that, to me, when we talk about other jobs, I can get my head around it. I think, okay, that's all right. But I think for the large majority of people, the idea of a robot being responsible for your diagnosis or doing your surgery, which we'll talk about in a minute, is actually really quite scary, isn't it?
Yeah, it could be. But again, I think it's something to be embraced. It is maybe the way the world is going and is going to go. It can be scary, but it depends. If for example you put your trust in this system, you didn't know it was AI, and I told you that this is actually 1,000 people sat behind a screen, you didn't know, and they were looking at x-rays, you'd still put your trust in that system, and then they were going to flag that to an actual doctor who's going to sit you down and go and highlight where that is. So that particular use isn't going to replace a physician. Then that doctor or whatever has to take that intelligence, that x-ray, discuss that with you. There's bedside manner there, which obviously
absolutely the robots are going to say, sorry Mr. Parkinson, and break some terrible news to you. Yeah. So that you need that human empathy, don't you, and that almost second opinion and what have you. But it certainly seems that there are a lot of positives and pluses to having this, like, elevated accuracy of a machine that essentially there's no emotion involved in it. They're just looking at images, aren't they?
Yeah.
Which I think is particularly relevant to, well, certainly when I've done my research, and I've done a lot of interviews in this area. I hosted a show quite a while ago, so good couple of years ago now, actually, and it was people who had developed their own software and it was mainly cancer detection, a lot of that being skin cancer, where they'd be looking at moles or blemishes, marks, and the accuracy on that was just mind-blowing, and this was at its infancy. So where are we at now then? Is that actually being used every day?
I would say it probably is. I don't have visibility of that personally, but a lot of, with any AI model or algorithm or whatever that is, over time the accuracy and the efficiency of that is going to improve because it's trained. The same as a junior doctor in time will always improve to become a senior doctor or a lecturer. That is constantly relearning, retraining and improving what it knows. So again, I don't know that specific application, but I would say yes, in theory, it will have progressed and improved and sort of been made a little bit more efficient.
Okay, so that's medical imaging, sort of giving an overview of what that is and how it's being used. What about surgery and like robots and all that, which sounds really terrifying? I mean, again, I've done some interviews on this and we looked at actually a particular software where it was kind of being used. But tell me from your experience then, what does that look like? Is there robots doing surgery out there right now?
Maybe not right now. I mean,
unsupervised.
not definitely not unsupervised yet. I don't think we're quite there just yet. We're probably going in that direction. I think the end goal is to be able to walk into a facility. There's only so many surgeons in the world and waiting lists are getting longer. So there's definitely the need for this sort of technology. And definitely, when you're looking at specialist types of operations as well. So having that as something that can be automated, that can be a 24-hour thing, that you're not necessarily waiting on the top specialist in the UK to do, is definitely going to go that way, I feel. Are we doing it right now? Probably not. But there's sort of lots of baby steps between now and actually getting to that. So remote viewing the surgery as an example. So I think there's actually a TV advert with Kevin Bacon at the minute for 5G, where he's got a barber doing a shave in the middle of nowhere.
Actually, I have seen it, yes.
That's sort of probably for me a bit of a stepping stone into that robotic surgery. It's having somebody remotely control a robot to perform something. So that's working on that accuracy of giving a shave.
Yes, no, I mean, that makes it really tangible, actually. I mean, it sounds like a silly example, but it's not. I remember we went to the VR show here to shoot one of our programs that we do for Scan, and there was a similar setup that was mainly used for training. So again, another area of healthcare. So it was training young doctors and surgeons, etc. But you could actually have a go yourself. It wasn't a real person, I hasten to add, but you could put your hand in almost this sort of contraption and have a go. I mean, gosh, it was mind-blowing and it was quite scary, like the accuracy that you have to have. But I would imagine that's actually probably going to become, certainly in training, maybe not whether that the end patient, but why not? If it's good, like you said, about putting our trust in certain things, there are probably things we put our trust in anyway. That could be several human beings you've never met. You don't know the background. You don't know that you'd get on with them, but you just trust their opinion. Why not be a robot? Yeah. I think it's just the overall, it sounds quite sci-fi and quite scary, doesn't it? So why not? If the accuracy of this, a robot, so to speak, is 99-100% versus a human being, well, surely you'd go for the robot option. But again, when we first talked about it, I was terrified, thinking there was absolutely no way on God's earth that would happen.
It's with anything that you've got to build that trust, and you've got to build a trust in that platform. As you as a not a consumer, but as an end user of that platform, if I told you that this is Steve the doctor and he's the leading specialist in the world, you'd want to see, in I don't know, any particular operation or whatever, you'd want to see some credibility, something to back up that fact. So, and again, that's just you building that trust level up in that he can actually do what he says. So, if I come to you and say that we've got complete trust that this robot is more effective and efficient at doing something, you'd want to see success rates of actually how many operations has it done? Is it the first one? Has it just cut a grape open? There's videos of that where they're showing the, again, precision of robots cutting the skin off a grape and then sewing it back. That's remote viewing. That's someone actually using a robot to do something. But again, that's all of that is baby steps and stepping stones into getting an algorithm, an AI algorithm, to actually be that person that drives that robot.
So in effect, could you have the top surgeon in the world perform your surgery remotely via a robot or some sort of AI system?
So that's probably, having a surgeon remotely perform stuff is probably happening right now.
That's strange to think, isn't it?
Yeah,
it's amazing, but it's strange.
So say, for example, it means you don't necessarily need to travel for operations. Say, for example, in, I don't know, South America, there's the leading knee replacement specialist, but you would have to either travel to him to have that operation. You could have it done in your local hospital as long as you've got one of these remote viewing rooms and he's got the time. So that, again, is a precursor. So then, he could then train or be involved in training a knee replacement model that then could be implemented as an offline procedure anywhere in the world. You could put that and deploy that in Australia, in Russia, in the UK, Europe, anywhere. And then that's almost as good as him because he's been involved in training that. It could learn from all the operations that he's done, all his experience of him using that machine, learning how he does that, and transfer his experience into our model that could be replicated and perform the same procedures.
It's mind-blowing, that, isn't it?
Yeah, it's for me, I get excited about it, thinking about it.
Yeah.
But because it's making the world a smaller place, if that makes sense.
Yeah. Everything's more accessible, isn't it?
Yeah.
So you use the example of maybe the surgeons in, say, South America. We hear and see all the time, people posting things about maybe a poorly relative that needs to raise some funds to go to another country. All of those barriers to getting access to the best people, effectively, they're reduced, aren't they? So whether it's a monetary thing of flying somebody over or somebody's too poorly to actually fly, or having this option is... well, it's like saving lives, effectively, isn't it?
Yeah.
How soon in the future? I keep putting you on the spot here, and I know you don't know all the answers to this, but how far in the future are we talking? Are we talking 50 years away? Are we talking 2? Are we talking 10?
Probably somewhere in between. is the honest. I mean, there's
in our lifetime.
Definitely within our lifetime. Yeah, there's baby steps. There's things that are progressing. I'd say in, I don't know, personal experience, everything accelerates, and the Moore's law used to be that computing power doubled every 2 years. That's changed now. That's sort of out the window. That's accelerating at a phenomenal rate. But with that additional compute power, and AI itself is exploding, the more that gets used and applied, and the more people that take on board that, it will grow and snowball and accelerate at a far faster pace. So I think with it, I don't know. Again, fact check me on this, but I reckon within the next 10 years or so that we should be within that realm of possibility.
I don't think that's too crazy a prediction, to be honest. I don't. We talked about the training a little bit there, but how is AI being used within the training of certain professions within healthcare then?
So for training, do you mean like the sort of the
doctors,
AI stuff?
Surgeons, that sort of thing? Yeah. Is it used in sort of training them to get to a certain level or whatever?
Yeah. So things like, or things that you could do, building a digital twin, for example, and then using, an AR, VR headset, exactly like you said.
When I had to go at being a surgeon,
yeah,
it wasn't very
that kind
good.
of thing is something that you could maybe build a digital twin using Omniverse or something like that.
Can I stop you just there very quickly? When we say digital twin, what does that mean? I'm imagining cloning yourself and there's somebody running wild. What's a digital twin?
So it's effectively a 3D map scan, a collection of images or a collection of whatever you want to sort of construct, a 3D visualization
Okay.
of something. It could be a building, it could be a person, but you could build, I don't know, for example, a digital twin of a knee. If we want to focus in on knee operations and knee surgeons, just as an example, and then that's our model that you can then, have 3D VR access into that, and then you can have all of the haptics in there to give you the real world experience of what it would feel like being a surgeon performing a specific operation.
I'm with you, right? So it's essentially like a digital, almost like a 3D
Yeah.
image.
Yeah.
So it's not something that I'm imagining another dad
Another Nikki
sat
stood next
here
to
with
us
us.
presenting. Yeah, no.
We could go off on a whole new tangent there, talk about holograms, but that's for another day. So okay, so it's essentially a way of being able to perform something virtually before you actually have to.
Yeah.
Or taking a look at a certain area of the body, using the example of the knee, seeing what's going on, and maybe using that to discuss with a group of doctors about how you'd approach it and letting them have a go.
Obviously in a very patient-friendly way as well. If you mess that up, then it's not like you've messed up an actual patient's operation. Yeah. It's something it's a friendlier and easier way of sort of training. So I think in training hospitals, that technology is definitely going to explode. So yeah, from a training perspective, from training, physicians coming from juniors to seniors or whatever that looks like, there's going to be a lot of that. Documenting and all of the information that is used and stored from the senior physicians, if they can train models and train certain things, certain algorithms based on their experiences, or even, I think we discussed it previously, that transfer of someone who's got 50 years of performing that one very specific knee operation and looking and analysing, documenting all of their notes, digitising all of that, but then applying AI algorithms there to sort of help pull out certain notes of specific fringe cases to sort of help with the training of younger doctors would sort of be a good application.
Yeah, it's really fascinating. So that's medical imaging that we've looked at. Then we've looked at training. What other areas of healthcare then are using AI at the moment, and in what ways?
So there's things like patient care, genomics. Patient care itself is a little bit similar almost to sort of what we discussed in a previous episode about retail when we're talking about frictionless stores. So it's using things like sensor data, using cameras to sort of map and monitor that patient's experience in hospital. So things, the bed management is a thing, making sure that the patients have got the right physicians aligned, making sure the right appointments are available, and moving all of that around. So it's sort of from an end user, a patient perspective, it's making sure they've got the right treatment as fast and as efficiently as possible.
Okay, really interesting. Let's take a look at the other side of things then, because we've talked about, developing drugs and the like, cures for things. How's it used in that area?
So there's, again, I don't want to go it's a very deep rabbit hole, this, but with genomics itself, we've actually been involved with some very public sort of resources very recently. And again, it's close to home, but with COVID research, Scan, we're involved in we provided some compute resource that was used to do an analytics and drug research around COVID, and that actually accelerated the time to results, and it allowed that industry to get faster drugs and faster cures at that time. So within the genomics industry, a lot of the traditional workflow can be, it's a 10-year process. You go through different visualizations, different models of, what a molecule looks like, studying the DNA and analyzing that and how all of that will interact with each other. Parallelizing a lot of that and using GPU accelerated compute, but then obviously using AI as well. With that, it can accelerate things from a 10-year traditional process down to 6 months. So
Which is phenomenal, isn't it?
Yeah, time to results is key there. I think actually Facebook, and I need to fact check myself on this, but Facebook did, I'm sure it was then published some research. Actually, through COVID, they had an AI algorithm or somebody had an AI algorithm that was then looking at different flu vaccines, for example, and modeling that and seeing how that would interact with COVID patients. And they actually identified a bunch of new treatments for flu as a sort of side effect. Yeah, because they were able to model and use AI techniques to sort of accelerate that time to testing. And that actually has sort of seen an improvement in sort of treatment now.
Wow. That is interesting, isn't it?
Yeah.
It's fascinating how it's been used. I mean, for you, what's the most exciting thing within kind of like the realm of healthcare in how artificial intelligence on behind that deep learning, machine learning is improving time, efficiency, etc. What's the most exciting part of this for you then? Because I know both of us like find this very fascinating, and obviously we're talking about real life retail and everything. It's great, you know, we get a better customer experience, but in essence this is looking after our health and our family's health, and in the future, you know, who knows what you might be able to access that you can't now. So it is a very exciting area.
Yeah, definitely.
What for you is the thing that gets you kind of most excited or you're interested in?
I wouldn't say there's one thing. I mean, obviously the robotic surgery is, for me, you know, where that would and could go. It's the very start of that curve that could create all new industries. It could create separate arms and different ways of implementing things from the development and training that people go through to get into that. I think there's a sort of a combination of things. We are using it now that's improving patient experiences and patient care. That's for me, that's exciting and interesting because there's a lot of information out there in the news about, you know, obviously everything that's happened over the last 2 years. The NHS over here in the UK has been impacted massively, you know, with waiting times and things. So anything that can improve patient experience and lead times for them is definitely a big win for me. But I think, yeah, I'm very much a futurist. So I've got one eye on that whatever that robotic surgery could look like.
Yeah, I mean, that could be mind blowing. Like you say, if there's one really great surgeon for such a thing, you know, it's wait times. Essentially, if you could replicate him through this training process and this modelling that you could do so that there becomes 10, maybe. Who knows how many. You mentioned there about obviously the impacts on the NHS, which I think we all know has been quite devastating. And from various aspects, you know, like family members or yourself maybe trying to get a GP appointment has been kind of very, very difficult. How is this going to help? Or how is it being, first of all, how's it being used already, artificial intelligence, in your local GP surgery then, just to make it really relevant and local to people? Are they using AI at the moment or forms of automation maybe at this present moment?
Some of them are. There's a big sort of digitization process going on. And again, it's not necessarily for everyone. There are still local GP surgeries there. We've got a GP app for our local surgery, and you can upload pictures to that. You can have a video call and they can sort of pre-scan almost with AI. But that, you know, this could then, again, I don't know for a fact, but it would likely be built on some form of AI algorithm, similar to what we've talked about before of, you know, with the Uber reference of making sure the right driver's available for the right journey, making sure a doctor that's pre-scanned certain symptoms and knows and understands certain conditions is available to talk to you, and they don't necessarily need to be in your local surgery. So making sure a GP is connected to the patient and can have that video, that remote call.
Yeah.
So it is likely used in these apps that a lot of surgeries are trying to get patients to use now. Again, you won't see it. Yeah. You won't know about it, but there'll probably be some form of underlying AI driving a lot of that user experience.
Yeah, that's really interesting actually. Now I know we can't talk too much about kind of the ins and outs of it, but I know that Scan AI have been very involved in some really fascinating sort of medical related AI projects rather. So can you tell us about any of them?
Yeah, one of the big ones is actually publicly available on our website, and it's a multi-phase approach. So there's probably a way better, a better explanation of the project on the website. We've done lots of case studies. So we did something with King's College London, and that was centered around the healthcare space. Again, it's multi-phase approach. The first phase of that was looking at that patient journey, that bed management, and then that scaled to a sort of a multi-phase, multi-year multi-site approach now. So it's sort of, again, snowballing. There's far better explanation and information available on the website about that one.
Yeah, I know we've done some videos as well, so people can watch that. And there is also, it's very sensitive information, isn't it? And it's quite its infancy, like you said, it's going to be phased out and stuff. So there is things that we can't talk about. But in terms of actual experience that Scan as an organisation, Scan AI, have had, is it quite a popular area then that people, more so than some of the other areas that we talked about, like retail and everything? This is actually, it's a bit of a game changer, isn't it? So is it quite a popular area that you're seeing inquiries come from? And as I said, actual real life projects that we're working on and that we're involved in.
Yeah, definitely. I'd say it's probably the most affluent at the moment. It's definitely, we see the biggest investments. There's a lot of higher education research organizations that are partnering with trusts and whatever that looks like. So there's a lot of healthcare applications out there at the minute. It's getting a lot of interest because there's real world actionable benefits for the general population. Other industries are sort of taking it up, but I think because of that nature that a lot of healthcare is led by research, by R&D, and they've got a lot of the right technologies embedded in there already. It's been easy to accelerate that industry. They've had the need, as we've said, over the last couple of years, but obviously they've got the facilities and resources now. That's definitely been the biggest and most, the largest consumer of AI almost, or the biggest, where there's the largest amounts of AI applications in real use right now.
Wow, that is interesting, isn't it? Because I think we spoke about the other ones and obviously retail and everything. Yes, there's a customer experience, but it's driven by profit. Whereas healthcare, I guess, is more driven by saving lives and making, coming up with ways to make people better and different medicines and drugs and things that they can try. So it's really, from a human standpoint, it's really powerful, isn't it? It's really exciting to see where it's going to end up.
Yeah. And again, I think this is where hopefully we're trying to educate people that AI maybe isn't as scary as we've perhaps made out. We've talked about different topics and different industries. From a healthcare perspective, it is definitely something that's going to assist, that's going to help and make things better. But that's going to be a trust in AI in general as a technology. Arguments could be made, if you trust AI to perform an operation, then you can trust it to recommend a skirt.
Yes, well, quite. The two are quite different, aren't we? But like you said, ultimately, AI can save lives.
Yeah.
It's that simple, isn't it?
It can, yeah.
Dan, thank you very much for your time today, as always. We have just scratched the surface. I know we will probably revisit this topic in future ones. And coming up, we're going to be taking a look over the next couple of episodes. We're going to do the use of artificial intelligence in media, gaming, entertainment. What else are we going to be taking a look at?
We'll probably get a few more people, get some actual case studies in. So get some people from actual businesses who've actually put maybe some of the stuff that we've talked about actually in action. We can maybe look at the financial services industry as well, because that's quite a big user of AI.
So still loads of things to uncover, loads of industries to take a look at. If you are watching on YouTube, of course, you can drop us a comment below if there's anything in particular that you're itching to find out. You can put it to Dan and I will quiz him for you. So plenty to look forward to. Join us then. Dan, thanks again, and we'll see you next time.
Thank you very much.